in this tutorial, we are going to learn how to discharge and depart our patient. So at this point, we have completed our forensic exam. We have done our medical intake. We've collected the triage medication that we need, the triage information that we needed to collect. We've given our medication. We've collected all of our forensic exam swabs. We've also administered, submitted the order, wrote the orders and submitted the orders, and executed the orders for medication and STI testing. And so at this point, we are going to make sure that all of our documentation is complete, and make sure that our patient's discharge instructions are also complete and accurate. So how to do that is we are in ambulatory workflow. As you can see at the far left, ambulatory workflow, and we want to add patient education. So we'll come down here to patient education with the red asterisk. We will select it, and patient education is now kind of at the top of our work board. So we'll come to the plus sign. This one's in gray, not the friendly blue, but that's okay. We'll select it, and we can select SANE. And as you can see, we have aftercare instructions for variety, including in Spanish, pediatrics, pediatric non-acute, strangulation instructions in Spanish and in English, okay? So what we want is we want to select the SANE aftercare instructions. And if you want, at this point, you can add it to your favorites by selecting here as well. And once you add it, it's added to your menu under added education. Now we're not done. We need to modify these instructions. And so this is the screen that you come to modify the instructions. We want to make sure that we add the kit information, always FSB, KIT, and then the number. We'll say, and that is the kit number that has a sticker on the evidence box. So we'll say the kit number is 23. I like to go ahead and highlight this in bold. And so to do that, I highlighted it with my mouse, and I come up here to the B for bold, and it went ahead and bolded it for me. The next thing that we want to do is we want to kind of take a quick glance at these instructions, and anything that's not pertinent to our patient, we can go ahead and delete. So, for example, if there are no injuries that we saw on our patient, they don't need to come in for a checkup, we can highlight this and delete it, okay? If they do need a checkup, you can tell them that they need a checkup in the next 3 to 5 to 7 to 10 days, and you can put that number here. In our example, our patient is healthy, we didn't see any injuries that we need to see them back for, so we can highlight it, and I press backspace or delete, and then I'll just kind of format it and clean it up a little bit. STI genital care, you know, I leave that in. STI testing, if they did STI testing, then I'll leave this in. Strangulation care, if you did include the strangulation addendum, which was in the patient education list, you can keep that here. Otherwise, if our patient was not strangled, then we can highlight it and delete it. I always keep the follow-up with your doctor for follow-up on medications, vaccines, or additional testing. I always keep the retesting as needed. Because we do offer the Depo-Provera injection, we can include when they're due for their next dose. It's always going to be 3 months after the dose. So if we gave the dose on May 19th, then their next dose won't be due until August 19th. If we did not give them the Depo injection, we can highlight this and hit backspace or delete. And then if there are any additional instructions that we talked about with our patient that we want to put in here, we can do that as well. Otherwise, we can highlight that and delete it. As you notice, the crisis phone number for Coalition for Family Harmony is here. And if they have any questions for the medical coordinator, they can reach out to them at reach out to the medical coordinator at the number here. So at this point, our aftercare instructions look complete. We can sign this. And now we want to go ahead and depart our patient because they are ready for discharge. So what we're going to go ahead and do is we'll head up to the gray bar at the very top, and there's a little door that's open that says Depart, and we're going to select the Depart Process button. This is going to show our after visit or our visit summary for our patient, and as you can see, information from our medical intake is shows up here under the vital sign, our height and weight, the diagnosis, our ICD-10 code that we saw them for, any orders that we did this visit, including the sexually transmitted infection testing that we did. If we did a point of care pregnancy test, that'll show up here. Any allergies that they told us about. And then here are the medications administered this visit. And then any known current prescriptions and reported medications are here as well. And then down here is our aftercare instructions. Okay, so everything that we kind of put in. And if you feel good about how all this looks, you can go ahead and hit print. And then you can document on your CalOES form the time that you departed them. And that is how you depart and do the discharge process for our patients.